people that have insurance like the fact that they can access health care when they don't feel well or when they have a real medical situation. They like that. But most people, I mean, we saw there's like 1 or 2 people that don't dislike their insurance company. Most people would rather have a system that provided better care at lower cost. So I have a friend who says, how do you explain Medicare for all? Like, how do you explain single payer? And this is what he says. You go to the doctor, you get taken care of, you go home. That's it. And not to be sort of facile about it, but it is true, right? The idea of single payer is that there is one payer, that's single payer, one payer. That would be the government. It would be a trust fund set up that would pay for medical need. And so you wouldn't have what we currently have. I don't even know how many payers, right? You get a lot of insurance companies, you've got a lot of individual funds, you've got a lot of people on private insurance, like you have all these different systems. And rather than that, and like, oh, this person has a $25 deductible, this person has a $40 deductible, this person has a co-insurance of 80%, this blah, 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 right? You go to the doctor, you get taken care of, you go home. Done. You go to the hospital, you get taken care of, you go home.
If you have to have x-rays and all this kind of stuff, will just having Medicare, will they require documentation? Will it be a long process?
No. So the idea is, then the 1804 and HR 676, the 2 bills that are pending in Congress now, one in the House and one in the Senate, the idea is that they would improve the current Medicare system to allow for increased access and expanded coverages. The way that we, in the nurses union, the way that we define proper health care is safe, therapeutic, effective health care, not based on your ability to pay. Currently, the system is sometimes safe, usually therapeutic, hopefully effective, and absolutely based on ability to pay. That is not a system that we support, right? That is not a system that we think should continue in the richest country in the world, right? We should not have people who die because they don't have health insurance. So one of the ideas behind HR 676 and S 1804 is that all of that privatization would be eliminated, right? So currently, we all know, like, who makes money on these for-profit insurance companies? Like, this is a market-based system, right? Whether or not you have health care is based on the market, right? As opposed to based on the medical need. And so the insurance companies, private equity has all these big investments in these insurance companies. Private equity owns a lot of hospitals, including some in Sarasota. Right? Private equity owns these hospitals. And so they are making a ton of money off of people being ill. We'll put aside the question of whether they make even more money if they don't take care of people by providing enough staff to do that. We'll put that question aside for the moment. But that is happening. And so you have this problem of, it's a market-based system, we have a market-based economy, and and everybody's encouraged to do it that way, right? So the purpose of 676 and 1804 is to remove healthcare from the market-based economy and have it be a publicly funded system that provides healthcare for people who need it. Let's look at what would be different if you were under a single-payer system. Profit incentive is gone. There's no insurance industries trying to make a profit under this system. So that $20 billion a year that's going directly into the profit of the health insurance industry, gone. Right? That just goes right back into providing care. Currently, the way that the system makes money is by taking care of people once they're already sick. Right? But if you're that's the market-based system, right? How do you make money? Somebody gets sick, they go to the hospital, they have surgery, they stay in the hospital, they get a huge bill for $40,000, $50,000, $175,000, whatever, right? Thousands and thousands of dollars. Under a single-payer, publicly funded system, the incentive is to make people not get sick, right? Because it's all coming out of the public trust, right? So your incentive is to provide preventive care, wellness care, education around what makes you healthy, right? Trying to figure out ways to have people not get sick, right? How to provide chronic treatment. Like if you have diabetes, provide that treatment, prenatal care, asthma treatments, right? All those things that stop you from getting sicker and sicker and sicker. Screenings for cancer, all the things that people don't do now because they have to pay for it. If you all of a sudden didn't have to pay for it, you would get it and the entire community would be healthier. And people who have coverage through their employer would be liberated. You'd be able to do whatever you wanted. You could decide to write a book and not have to go to work. I mean, if you had some other source of income, you could work some small job to have income and do something that you just really wanted to do, but you wouldn't get health insurance, right? So, any other ideas of what would be different?
I think the doctors here in the United States forgot about the humane act of treating someone because it's too many dollars involved. So I think it would get doctors back into a track of actually treating people rather than thinking of the next boat they're going to buy.
Well said.
Well, and it's going to put doctors back in charge of healthcare. It's going to put healthcare providers back in charge of healthcare instead of insurance companies dictating what those doctors can or cannot do.
It reduces the overhead costs for doctors' offices, hospitals, whatever, because you don't have to have a gazillion people trying to figure out how to code this so that the insurance company will pay for it. My dad was a primary care physician, and he got out of it because he couldn't stand to be dealing with the insurance stuff, and he went and started running a free clinic in his town where he didn't have to worry about it, and he could just care for patients.
I don't know who it was, went to Canada to tour, it might have been Bernie, I can't remember, it was somebody, went to Canada to tour like a healthcare setting. And they were like, okay, so now let's go look at the billing office. And it was one person. It might have been Michael Moore, yeah.
The good thing about all of it is it takes pre-existing conditions completely out of the picture.
Right.
Which is such a big deal.
It'll be very liberating for a lot of people if we had a single payer system here.
Having a clearer sense of how that would be done in the actual implementation, right? So I'm hearing, for instance, the idea of Medicare for all. It sounds nice, it's easy, but I know that even in Germany, we don't walk into the hospital and walk out and nothing happens because a lot of things are happening behind the scenes. I would like to understand that so that I can explain to other people.
The how, right? So currently people buy insurance based on whether or not they can afford it, or their employer provides it, or they access the doctor or hospital, care based on what they can afford, right? Under the Medicare for All system, first of all, they're going to improve it. That's part of the deal. But the second piece is the way they're going to pay for it is the employers would pay a 6.25% payroll tax, and the individuals would also pay a 6.25% payroll tax. So there's this big red herring that floats around. They're going to raise your taxes. Yes, let's just be honest about that. They're going to raise your taxes by 6.25%. But the average that people pay right now, even people that have insurance, the average cost of accessing health care in 2016 was $10,300. Okay? So you figure, all right, so if I only pay 6.25 instead of that $10,300, how much money do I have to earn before I would pay $10,300 in taxes as my 6.25%? I'll do the math for you. It's $175,000 a year. So anybody who makes less than $175,000 a year is better off under a Medicare for All system. People making over $175,000 a year, sorry, you can afford it. There's a gigantic disconnect between the policymakers and the real life people, right? The gigantic disconnect is, how much is $10,000 worth to you? I would rather not spend $10,000 getting health care for my family, right? I'd rather spend whatever 6.25 of my income is, I'd rather spend that paying toward a single payer system. The other way, they're so out of touch. People love their insurance company. No, they don't. That's a policy disconnect. They don't know that. People will think it's a huge tax increase. No, policy disconnect. Most people will be better off by not paying the $10,000. Like the people who are making the policies, probably a lot of them do make more than $175,000 a year. And they're like, whoa, 6% tax. Well, I don't pay that much in my health care. Well, no kidding. No wonder you don't. You make so much money, it's not worth 6.25 to you, right? Remember when Gary Cohn, the economic advisor to the president, said, we're going to provide a $1,000 tax rebate to middle class. They could buy a car. They could remodel their kitchen. So $1,000 and $30,000 have the same value to this guy, right? Because he has so much money. But the difference between $1,000 and $30,000, real life people know that difference. But the rich folks that are making these policy decisions do not. Right? That's a huge policy disconnect.
So I know that with Medicare, the government can't really negotiate drug prices. I want to think, transitioning to that, how can we negotiate with hospitals that do the charge master that charge like 3 or 4 or 5 times the price of the actual procedure? Like, how do we get the cost to go down?
So when you have a single payer, and it is a publicly financed single payer system, they set the rate. The cost ratio in some places is 1,000 times what the cost was. Like when they do the math, some of these for-profit hospitals charge 1,000 times what the actual cost was, and that just would simply not be permitted under a single payer, because you have this, like, you know, I mean, I'm not currently a huge fan of the federal government, but generally speaking, the idea that you would have a government that's for the people, by the people, right, would look at this and say, well, we're not going to pay $400 for a Tylenol that you can buy for, $4, right? I mean, you can buy a whole bottle for $4, right? So, I mean, they're just simply not going to, it's not going to be permitted anymore, right? That kind of basically profiteering and robbing of people just...
The outrageous cost is, part of that also gets eliminated because now you don't have uninsured patients coming to hospitals or whatever, where they're having to be treated, and then that cost gets borne by people who do have insurance.
Right.
That goes away. So those costs can come down.
Well, and emergency room care is the single most expensive way to treat people, right? If that stops, you're right, the whole system costs less money.
For like every single office, doctor's office that you walk into, there's one physician, a secretary that answers the phone, 2 nurses, and 10 people doing billing. So what they've determined is that approximately 30% of the costs that we spend on healthcare in this country are administrative costs, just trying to get billing done. And like you said, appeal after appeal after appeal. So if you've got those 20 people doing billing in your office, imagine how many providers that could pay for. And that's what this Medicare for All is going to do. So, I mean, it's going to eliminate a lot of jobs initially, but those jobs can be, those people can be retrained, but you're eliminating that huge, 30% of however many trillions of dollars are spent on healthcare every year. You're taking that money and putting it back into the healthcare system and taking it out of the billing and administrative process.
Why there's such strong opposition to Medicare for All or single payer, because who's making all this money?